That's why we need public information without delay, with strong and effective institutions to keep citizens informed. Access to information is not a burden, but a right that needs to be supported by law, and any restrictions to this right should conform to the law, be proportionate and limited to protect the citizens. Join our high-level webinar on 28 September and all the online events across the world that UNESCO and partners are organizing to celebrate our right to access information. Go to our website for more information. Access to information, saving lives, building trust, bringing hope.
Good afternoon, good morning, good evening, and welcome to this, what promises to be an extremely interesting webinar on the topic access to information in times of crisis. I want you to remember that this panel is organized as part of the celebrations of the International Day for Universal Access to Information. We have a great panel today, and I want to especially welcome all of them. We have Toby Mendel, who is the Executive Director of the Center for Law and Democracy, Lucy Ndugu, Information Commissioner for Kenya, His Honor Alexandre de Moraes, a Justice of the Supreme Court from Brazil, as well as Eduardo Bertoni from the Argentine Information Agency, and my dear friend Laura Newman from the Carter Center. There will be 2 rounds of questions, dear panelists. Please keep answers within 5 minutes so that we have enough time to have a really interactive session. For the participants, let me mention that if you wish to ask questions, these should be put into the chat, and I can see there's already a message in the chat, and I'm being reminded that I actually missed one of our panelists, Anthea Sellers, who is the Secretary General of the International Council of Archives. Anthea, please excuse me for that gap. Let me start by asking Toby a little bit about the work of the Center of Law and Democracy. It's well known for monitoring of legal developments in the field of access to information. CLD authored the UNESCO publication titled The Right to Information in Times of Crisis. What were the most frequent restrictions on access to information during the pandemic? And what are the main recommendations for the member states and civil society? Please unmute your mic.
That was fortunate that my mic was muted because my phone just rang, so I avoided an embarrassing interference there. I did that on purpose, of course. Sorry, the Center for Law and Democracy basically did 2 main things when the COVID pandemic came about. The first was we put in place a tracker. So we have the RTI rating, which assesses the quality of all of the right to information laws around the world, how strong they are. And we realized very quickly that a lot of countries were introducing restrictions to the right to information during the COVID period, and we needed somehow to reflect that on the rating. We didn't want to incorporate that into the main rating because we hoped that those would be short-term measures. So we added a COVID tracker. And then, as you mentioned, we did actually 2 papers, one for UNESCO and one on behalf of the Center for Law and Democracy on the legal framework for this. if we look at what states did, by far the main measure that states took, where they took this measure, and a small minority of states actually made formal legal changes to their laws. They either delayed or suspended entirely the processing of requests. So we saw some countries triple, for example, the time limits from 20 to 60 days in the case of Scotland. Other countries just suspended entirely the processing of requests. We saw a few countries that put in place formal measures to facilitate the ongoing process of requests in these new circumstances, for example, by authorizing electronic notice as a formal procedure as part of the system. And we saw some countries apply those measures also to the appeal system. So they either delayed the appeal system or facilitated in some way in terms of processing. In terms of the report that we did for UNESCO, and our recommendations really were based on two foundational concepts, neither of which we felt were particularly strong or stringent. The first is that RTI is a human right. It's clearly established as a human right under international law. UNESCO has been treating it as a human right. And that had implications for legal measures. First, any restriction in law needed to be set out properly in law. So the law needed to be adopted in a proper way. There's nothing about the emergency or about an emergency which allows you to avoid the rule of law, the proper passage of laws and the proper implementation of those laws. And secondly, that legal restrictions either had to be necessary, or even if they were adopted in response to the emergency, they had to be strictly required by the situation. So that's quite a high standard. And we saw, I think, many states put in place fairly knee-jerk reactions. They just suspended the processing requests without really looking at that from a human rights angle and considering whether that was necessary. And the second is that we maintained from the beginning that the RTI system continuing to provide information to citizens, both proactively and on request, was part of the response to the pandemic. It was not just a government business which could be suspended. It was an essential pandemic-related service. It was required to save lives, as the banner line for these UNESCO events says. It is also required to ensure that the economic measures were done properly, were done accountably, were rolled out effectively. So we saw it very much as a core part of the response to the pandemic. When it comes to the proactive disclosure of information, what we saw was that by and large, a lot of states made a big effort in that area, and we felt that overall, I mean, with some certain exceptions, the response was not too bad. States tried to push out information. A lot of the time, they did the best they could. Of course, they needed to collect accurate information. That was a challenge in some states, but it wasn't too bad. Unfortunately, on the request side, we didn't feel that the measures were quite as good. We saw, as I mentioned, some knee-jerk reactions, and sometimes those knee-jerk reactions were pulled back. So Scotland, for example, extended timelines by 3 times from 20 to 60 days. But then already by the middle of April, they amended that and they put the timeline extensions on a case-by-case basis, which is very much what we felt was more reasonable. So one of the recommendations we made was that there should not be blanket changes, that any changes, any extensions to timelines needed to be justified on a case-by-case basis. If you really can't get into the office to get that piece of paper to answer a request, okay, it's reasonable to delay the responding to the request. But we certainly felt that responses by government where they said, we're too busy, we've got other things to do right now, we felt that that was not legitimate, both because this is a human right and you are not too busy to deliver human rights, but also because it's a response to the pandemic. And nobody said they were too busy to supply healthcare or to do other essential actions or even to supply groceries to citizens. So we felt that that was not a legitimate response. And we felt that even where there were logistical barriers, for essential services, governments managed to carry on. They went into the office from time to time as needed to collect essential papers so that they could provide essential services. And we felt that that was the proper approach with the right to information.
Thank you so much, Toby.
We have a lot of recommendations, but those are some of the key ones.
I can see you're very passionate about this topic. And afterwards, I'm going to ask you to talk a little bit more on how you feel access to information actually saves lives and builds trust. Let me move to Lucy. Lucy, today we are talking about the right to information during crises and the role of information commissions, which in many countries are responsible for the coordination of access to information policies and implementation of the related laws. A few years ago, commissioners from all over the world had established their global network, the Information Commissioners International Conference. What was the role, in your view, of these institutions during COVID-19, and what have you learned? What should be done by the commissions and equivalent organizations?
Thank you. As you said, ICIC is a permanent body or network which came together to connect ICIC commissioners. And we had a goal, which was to protect and promote access to information to the citizen. During COVID, we did meet as ICIC, and we were encouraged to, first and foremost, insist that ATI law, or the legal framework of ATI law, in respective national and international agreements must be maintained if we were to save lives, build trust, and bring hope to the people. In actual fact, we were all encouraged as ATI commissioners to ensure that we do give, or we do ensure that public institutions release timely, accurate, and trustworthy information. Further, we were also encouraged as ICIC commissioners to continue doing our oversight and enforcement role through the proactive disclosure principle. This is all engraved in our laws, but at this time, we truly needed proactive disclosure without prompting public institutions to do so using technology or any other means whereby public institutions could pass information on COVID real time so that we save lives. And we saw this one happening. Public institutions, including the Ministry of Health, especially in Kenya, coordinated groups of people, all other institutions, and were able to come up with protocols, guidelines, and platforms where information was shared. Further, as ICIC commissioners, we did encourage all institutions to try and digitize records because people are working from home and we needed to receive information and forward to the requesters on time. And in our case, that is Kenya, we did see the judiciary and the justice system coming up together and agreeing on modalities and guidelines and policies on how they will share information to their citizens to dispense justice during COVID-19. Further, as ICIC commissioners, it was imperative that we do review decisions which came to us. And in our case, we found that many requests related to pandemic going to the Ministry of Health were not being responded to because of delay, the issues that they were very busy. And we did try our best to respond, but we find that 80% of the requests have not been answered. But we were encouraged to continuously request our officers to review decisions and provide information. As ICIC network, I must confess that we have been meeting, working together, networking, sharing information, and coming up with certain standards of disclosure. We even issued statements encouraging government to secure records and to keep them for future pandemic. So the lessons I have learned as ICIC commissioner is that it is important to maintain the rule of law continuously, even during pandemic, but we need to be flexible and amend certain laws or certain regulations to address the need to save life, build trust, and bring hope. That one was seen, and we did notice that our commission issued a circular whereby we guided public institutions on how they will deal with procurement in times of COVID and where corruption was being arranged. Further, the lessons learned was that we need to expedite appeals and sanctions during COVID. And as ICIC member, I do recommend that ICIC continue as a network platform whereby we can also meet during the celebration and talk about access to information as a right which every citizen must have. As a way forward, I recommend that we all come together as ICIC and look at those gaps which have not been addressed by our laws and recommend our government either internationally to come up with an agreement or nationally to come up with certain regulation to address pandemic and ATI laws. Further, we need to really work hard to digitize our records and at the same time train our officers, not just ATI officers, but also officers in government institutions so that we integrate ATI in our day-to-day activities or service delivery. Thank you very much.
Thank you, Lucy. And I was amazed. You were exactly 5 minutes. Let me now go to Eduardo. Eduardo, you know, we are hearing a lot about saving lives should be a priority. I think Toby touched on that, those knee-jerk reactions. But you know, saving lives as a priority, and then the fact that some see that international law allows you to prioritize in that way, and therefore limit some rights during an emergency. What would you say about this? Why is access to information so important during a crisis, and particularly this pandemic? How does access to information actually save lives and build trust?
Thank you very much for the invitation. I am the director of the Access to Public Information Agency, which is the governmental body, the administrative body that controlled the enforcement of the Access to Public Information law in Argentina. And today, specifically today, we are celebrating 3 years that our law was enacted. So this week is a little bit crazy for us. Yesterday, we celebrated the Universal Access to Public Information Day. Today, we are celebrating here in Argentina 3 years in motion. And your question is really important for 2 reasons. The first reason is that we can give this to this question and some sort of an intuitive answer, which is, well, it is pretty obvious that if you have information regarding the situation of the pandemic, where are people that have more diseases, where are the doctors, how you can go to a specific medical facility, and all of this is provided proactively or informed. If you request information, probably you are going to save lives because people can access to that. And this is, in some way, is why we usually mention that access to information is a concrete tool for the exercise of other rights, in this case, the right to health, for example. But I gave you some concrete ideas on why access to public information can save lives. But what I want to stress here, and you mentioned something about suspending the right in a situation of emergency. I think that we are going to continue this conversation in the next part of the panel. I think that it is possible to suspend fundamental rights according to international law, but in very exceptional circumstances. And even though we are in an exceptional circumstance, particularly access to public information and freedom of expression are fundamental rights that should not be suspended. And I will tell you afterwards our experience here in Argentina. But what I want to mention here is that even though I gave you an intuitive answer, for years, when we were advocating for access to public information laws, for more information provided by the government, we always reach to the same situation. And I'm seeing Laura, Toby, they know pretty well what I'm going to say. We need concrete examples. We need concrete examples that shows the general people why access to public information is an important right. Not only to explain theoretically why it's an important right, but putting faces to the exercise of access to information, putting concrete faces, concrete cases on how access to information impact in the life of the people. So we are in a special moment that it would be very important if we can keep records about concrete cases in which the exercise of access to information impact concretely in the life of people. I don't want to miss the opportunity as an advocate for access to information, to public information. I don't want to miss the opportunity to have this information for the future, because we will need again and again to advocate for more access to information and give examples on how this play during our pandemic will be key to convince people that are not already convinced how important is access to public information. Thank you.
Thank you, Eduardo. I'm sure that as we go through the panel, we will become even more convinced of your position. I now would like to turn to Anthea, Secretary General of the International Council of Archives. Archives, especially in the digital environments, cover all dimensions of information, records, and data from the point of creation up to when they are transferred. What was the impact of the pandemic on these important functions? What are the lessons learned? And what do you see as the best practices worldwide? How should we, from the one hand, use the power of digitalization, and from the other hand, try to avoid digital divides, especially in this time of crisis?
Thank you, Dorothy, and thank you for inviting me to speak today or contribute to the panel. So as you've rightly said, I think the critical function of an archives is not simply to be the repository of a historical record. ICA represents organizations from across the record-keeping spectrum, from the point of creation. And I know many record services during COVID were inundated with requests and worked over during the crisis period to ensure that government departments, that private corporations continue to have access to their information throughout the period. And to enable, especially for governments, that decision-making and the provision of accurate information to citizens. I think the major impact is really, for us, was trying to identify where all the information was being created. And I think we tried to identify that and tried to ensure that governments were aware of their responsibility in a statement that we put out with ICIC, as well as the Digital Preservation Coalition, the ARMA, CODATA, Research Data Alliance, UNESCO, and World Data Systems, reinforcing that critical importance to document in a time of crisis, that it doesn't stop. And I think our great challenge was ensuring that all the information that is being created is properly identified, so that when there is an access request, we know where to go, we know where the data holdings are. And when the time comes for that information to be sent to the archives, to the historical repository, we can transfer that information to ensure public accountability and transparency of government decision-making processes, as well as private corporations that are working more closely with government are documented. But I think that's a challenge because you have governments that had, and private organizations that had to stand up operations incredibly quickly in the digital domain. Although we already had capabilities in that area, it's that all of a sudden we had to do all of these different functions, from project management, from data creation, in a distributed manner. And, and I think that was the greatest challenge for us in terms of ensuring the integrity of that throughout the piece. I think the lesson for archives and record services is that we continue to offer services. We didn't stop because of the pandemic. We continued to operate. ICA ran what we called is a service called Archives Are Accessible, so that even though physically the institutions themselves were closed, people could know what services were still available. What we found was that 80% of our archives still had online catalogs and online services. They were still offering reference services. Our record services are more internal looking services. And so they were really serving the government department or the corporation. So they're not as outward publicly looking, but they were still operating and they were still running during that time. I think in terms of best practice, it depends on what part of the world you're in. There are different capabilities all over the world. And I think we need to take that into account when we measure accountability and transparency. What is doable for the UK may not be doable for places like Cameroon. And so what does this look like? I couldn't say what is the best practice, because I think it puts different organizations on an uneven footing. And I think we need to measure them where they are. We need to push them, of course, and to create better services, to ensure that information is captured, that it is made available to citizens, that it is made available in a timely manner to government departments. But I think to try and set a bar, an international bar, I think is unachievable. I think that it's more of a maturity model that I think we need to look at when we talk about these types of best practices, and where do we want to get people and where do we want to get people to be around access to information, around information capture. And I think when we talk about access to information, I think when we talk about duty to document, we cannot forget that there is information behind this, that there is a whole profession, my profession, that sits behind a lot of this, that ensures the integrity behind the scenes, that ensures that, when decision makers ask for that information, it's there and it's delivered in a timely manner in as much as possible. But I think too, we need to take into account that documentation, and I think it was Eduardo that said it, or somebody said it, it has to be part of the culture. If it's not part of the culture, or it was Lucy, pardon me, that said it, if it's not part of the culture, and the same thing for record keeping, it's going to make access to information, it's going to make information provision that much more difficult. I think when we talk about digitization, I think digitization is a tool. It's an access tool. And I want to make sure that we distinguish digitization as an access tool and as a facilitator to working, than digitization as a reason for destroying paper records. I think too often that happens, and it's seen as a quick win for saving space, but not a lot of thought is given about how to preserve the digital information that's the end product of that. And that becomes a problem, because if the proper standards aren't applied, if you don't have the right resolution, if you don't have the right work processes, the right facilities, the right infrastructure, you are going to get yourself in a very sticky situation where you could potentially lose information and compromise rights, compromise citizens' rights. And I have seen it working at the international level. So I think we need to distinguish between digitization as an access tool, which is what Lucy was talking about, which I think is perfectly valid and needed, and digitization as sort of this false fallacy of, if we digitize, we save all this space and we make our services more immediate without thinking about what the workflow is to get it to people, and then how to preserve that information over time. And all the preservation component digitally is forgotten when we talk about digital information.
Thank you so much, Anthea, for those very pragmatic remarks. At the same time, I think we're all going in the same direction. I would now like to invite Laura Newman, who is the director of the Carter Center, to talk to us a little bit about your work on assessing implementation, including proactive disclosure, which is critical during a crisis. And then I was fascinated, speaking to you from Ghana, to understand that you work closely with the police in Liberia. And so if you could comment a little bit on that experience as well. Thank you.
Great, thank you so much. Perhaps I should clarify that I am the director of the Rule of Law program at the Carter Center. There's a number of programs. So thank you again, and thank you for allowing me to be a part of this important panel. In many ways, access to information, as everyone knows, is the best crisis prevention tool that we have at our disposal. And you're asking about the Liberia National Police reminds me of how critical it is. Our experience over the last 2 decades has shown that when people have public information that's accurate, reliable, timely, and complete, there's greater trust in the institutions and less room for rumors to take hold. And this is true whether we're talking about health crises, land conflict, violence, or security issues. You also mentioned proactive disclosure. Many people on this panel have mentioned that. And the Carter Center, about 10 years ago, developed an implementation assessment tool. It assesses the extent and quality of an access to information law at the agency level. We've done this in 17 countries and over 150 agencies. The tool has 60 indicators, some looking at seeking and receiving information, responding to requests, some on records management, but also a big component asking about proactive disclosure. And interestingly, although we've all mentioned how critical it is, across the board, the area of proactive disclosure has received the least attention by the public agencies, by the governments themselves. The findings have shown that there's very few information officers who are trained around what information should be disclosed. There's often a lack of procedures related to proactive disclosure, and certainly very little monitoring of whether proactive disclosure is working. And this is unfortunate because, as everyone has said, proactive disclosure is the best way for governments to get information to people, particularly during a crisis. So now looking at our work in Liberia, we've seen how this can play out both positively and negatively. For example, during the Ebola crisis in 2014, the government was slow to react and even slower to share information. There was little information about the number of persons infected, means of prevention, what happens when a loved one was removed from the home and put into an Ebola unit, or even public services to support the community. After some months of what some have described as a bit of chaos, the government of Liberia developed an incident management team, which included a number of ministries, including the Ministry of Internal Affairs for Outreach and the Ministry of Information. Now, previously, the information had not been shared. And so there were tons of rumors coursing through Liberia about what is Ebola, how to deal with it, how to address it, that the government was taking people away and that they would never see their loved ones again. And so the Carter Center was asked to support a number of components of this incident management team, including information sharing. And in working with the ministries, we were able to develop a schedule for daily radio programs about Ebola, where experts came and shared information. In addition, we worked with our community networks of leaders and traditional leaders to share the public information. This led to a much more orderly means of dealing with the crisis and ultimately brought the end of Ebola to Liberia. Now, fast forward 6 years and COVID's hit, and the government was well prepared. They immediately stood up their incident management team. They immediately began flooding communities with as much information as they had. And working with the Carter Center, we actually employed over 3,500 town chiefs and town criers to share information across the board in Liberia. They've seen relatively few cases and even less panic. And I would argue that's largely because they had proactively provided all this information. We've seen the same with the National Police. Previously, the police were one of the least trusted institutions. Many of you may know they were formed from veterans of the bloody Civil War. They were seen as secretive and corrupt. But with some new leadership in the Inspector General and some of his top leaders, there was a recognition of the need to change their relationship with citizens. And one of the tools that they chose was greater transparency and access to information. So we saw when crises hit, whether elections or state of emergencies, the police changed the way they did it, and they started to really proactively share that information. And I think that for many of us, we've been incredibly pleased to see how getting information to citizens has tamped down rumors. And I know we may talk about it today, we're all talking about disinformation. Well, maybe the best tool against disinformation is actually giving reliable and accurate information.
Thank you so much. And actually your comments take us very seamlessly into the next short video, which is a testimonial from Mexico, where indigenous women, an indigenous woman is describing how she translated information into the language of indigenous people to help them understand the burden of the pandemic. So whoever's in charge, could you please show that video now?
Hinik aba hinik Lucía, que quiere hinik sukia antika listi ukamhel COVID-19. Ven añe chikani bal chi añe chilisubol chi lakchan, come me la kotiaño li lakpilo mach buyu holo bikash lanchan, yikot laklumal yomush kotik chami mele nya tiaño, chami mele kantiaño bibu. Chatsak kotik laklumal tiak pehtelel subol, Sakai wen kantiaño bibu, sakai poko bikup, sakai kanyo pishli ye yikot manik mitiolo kelo kipashal. Alak pilo sabuwen kahiyo chumenyo bisum. Bacheli chichoño yo chokyako yulo buñi kantia che tecnologías si kocha yo chaglak pilo mar buyulo bikash lanchan ilak ño chelo si chayo chakirayo come ora miña chaño yo mar la halik che tsibu bila chi come año mar buyuhu wilo bik pehkantiel hun.
Thank you. Thank you for food for thought. Laura, let me get back to you again. I understand that the Carter Center actually did a brief assessment in Bangladesh and Guatemala to see whether COVID-related information and information relating to social protection was actually reaching women and marginalized populations. What are the findings?
Thank you. I think the most important thing to remember on today, or yesterday really, September 28th, is that while it's an important day to recognize the right of access to information, we cannot yet celebrate. It is not actually universal for all peoples. Despite the 150 countries that now have statutory rights to information, women and marginalized persons are often not able to exercise this right with the same frequency, ease, or rate of success as men, and therefore can't enjoy the myriad benefits of a meaningful right of access to information. The Carter Center had done a study some years ago in Liberia, Bangladesh, and Guatemala with over 1,700 interviews. And we observed 128 agencies, and were able to demonstrate that, in fact, this hypothesis of an inequity in access to information exists. And this inequity became even starker during a crisis such as COVID. So while we've been working alongside government and civil society in these countries for the last years, we recognized when COVID hit that this asymmetry in information flows, this inequity, was going to impact women even more so than men. So as you say, our colleagues working locally undertook a brief survey to see whether women were receiving information about COVID, including prevention, but perhaps most importantly, its secondary impacts. So the impacts such as food insecurity, loss of income, and increase in domestic violence. And as many of us who work in the gender area know, COVID has been a disaster for women's safety. Women have been quarantined in homes with abusers, the court systems have not been functioning, the social service and the networks that protect survivors are not in place. And so part of our survey was really to understand, are women getting information not just about COVID, but about social allowances, safety nets, and about domestic violence and what they can do and where they can report it. So we looked at this in the 3 countries, and I just want to give, I know I don't have much time, just a few brief findings. So for example, in Liberia, which has an incredible issue with domestic violence, we found in a survey of over 2,000 people done by the Liberia Election Observation Network with support from the Carter Center's Democracy Program, that 61% of the respondents had reported a lack of knowledge or information about where to seek help, even though close to 20% knew of people who were suffering from beatings in their home because of tensions during the lockdown. And that's a horrible statistic to realize that the information isn't getting just at the same time as women are more insecure in their homes. And this is similar in Bangladesh when you think about who's getting information and about what. So interestingly, 99% of the respondents in Bangladesh had received information about COVID, but less than 40% knew about services that would impact women. So social services, network services. So when it came to information that might be relevant for men, that information was reaching. When it came to information that was most needed by women, it wasn't getting into the hands of those who needed it the most. This was also true in Guatemala, where we did another similar study asking both about COVID, but also social assistance and domestic violence.
Laura,
yes.
There's a whole network of gender activists. Where were they?
Gender activists have been talking about this. It's actually the place where we have a lot of intersections with other different networks and people working on this. And about 2 years ago, the Carter Center held a big conference on women's right of access to information because we understood this. All COVID has done is highlight this inequity and made it even more important that we address it. So I know there's not time, but one of the things we're doing, and this is with gender networks around the world, is the Carter Center is launching a new campaign called Inform Women, Transform Lives. And it's going to take place across a number of cities across the world. We're going to actually name the cities in the coming weeks. And a lot of that is, and Eduardo said this perfectly, at a time like this, and I think Toby said it as well, governments will say, but this isn't what we're most interested in, this isn't our priority. But actually information is foundational. And if you're not informing people, if you're not getting that information to women in particular, there's no way that they can use municipal services. They can't be part of the recovery that's going to be so important when COVID finally leaves our various shores.
Thank you so much. I love to hear these very concrete suggestions for a way forward. And I think that we have to acknowledge Article 19, the NGO in Mexico that produced that video, for making sure that key information was reaching women by women at this critical time.
Absolutely. And I just say one last thing, and that's to what you're saying. You need to be intentional. It doesn't just happen. We all have to be intentional about assuring that the most marginalized are getting the information just as the most elite do. Thank you.
And now I'm happy to move to another woman. Men, you'll be coming in shortly. Lucy, as in your capacity as the Information Commissioner of Kenya, could you tell us about the main challenges you see to access to information, its legal framework, and its implementation in Africa during the pandemic?
Thank you. And I will start by saying that Africa is a developing continent with many challenges. And when we come to COVID-19, we did witness these challenges. When it comes to ATI implementation and the legal framework, we do find a challenge on limitation. And I'll give the examples of Kenya throughout. In Kenya, our constitution states that no right is absolute. There are limitations. And Article 35 has a limitation in that certain information is not supposed to be disclosed, mostly information related to security, government procedures, but the one which touched us this time during COVID, is the restriction on private hospital records, that we could not access information from hospital or records of how they were treating patients or what they were doing, what they were using, yet that was so crucial to save lives during pandemic. So to us, we felt that this area needs to be relooked during, as we move on. Apart from the limitation on the rights, like someone talked about timelines, it was very difficult to maintain timelines and as envisaged in our act. And there is a section which says that information to save life should be provided within 48 hours. But we found that in the Ministry of Health, they were too busy to give us certain information related to quarantine, relating to how they were treating people, where they were taking people within 48 hours. Remember, people are not working at that particular time, they were working from home. And that one, we found that we need to relook our timelines. Further, as a government, we were supposed to digitize our records, but due to resources, we have not even done anything to talk about. But I'm happy to say that the Ministry of ICT did promise us yesterday during our meeting that they are looking into it and they're coming up with the policies. But as a law, we have to go back to that section on digitization and come out with how do we do it? Are we digitizing everything, or how are we connect? Can we connect in other platforms so that we are able to share information across board? Also, our act did mention that we are supposed to protect whistleblowers, and we did see the need to protect whistleblowers during pandemic. However, the modalities of doing so is not provided. So we feel that this is an area that we have to come back to our access to information law and talk to the relevant ministry to fine-tune access to information law, which is not yet passed, and also integrate it with our ATI law. We also have another area of data protection or personal data protection. We have a law. We have not yet implemented it, but soon we'll have a commissioner for data protection. And there are areas which are in that law and areas which are in our law which may conflict. So we feel that administratively, we need to talk, or using regulations, we need to agree on how to implement the two laws, bearing in mind that we are not in the same institution. And we also felt that during COVID-19, certain guidelines, certain principles, certain regulations which came on board needed to be relooked in line with ATI law, because some were hampering. Instead of helping, they were putting restriction. And this one we have witnessed. Thank you.
Thank you for those comments. Really, you are telling us that there needs to be an emergency response plan in place that would have looked at all of these issues. Really very interesting. I'll now like to move to Eduardo. And it seems that in several countries, the executive or other branches of government try to introduce legal changes to the right to information laws in response to the pandemic. In Argentina, the Information Commissioner explicitly affirmed their right to information obligations would remain in place. Argentina's Access to Public Information Agency adopted a resolution specifying that the decree generally suspending administrative deadlines did not apply to the right to information. What was your thinking, your rationale when you did that? And how did it actually pay off?
Thank you. Thank you, Dorothy, for this question. I think it's an important thing that we did. But let me before going specifically to that question, and I will be very brief, say that the beauty of this meeting is that you heard other people that inspire you to say and to reaffirm different things. When you put this woman from Guatemala, she talked about access to information, but I paid attention to what she said at the very end about the importance of community radios, which is something that we are not talking today, but this is something that it is in the program of UNESCO, and it is really, really important to strengthen, and it's a problem in many countries in Latin America. I know that as a former special rapporteur in my region. Laura inspired me to mention a couple of things. I mean, one is that there are communities that are disadvantaged communities, that they don't have proper access to access to internet. And it's true. I mean, we are in an era that access to public information in this moment of crisis is very important to have access to internet, to have access to information. But there are a lot of people that cannot access to information. So again, going back to UNESCO, I mean, it is essential to think about the universality principles of UNESCO, the Rome principles of UNESCO of access to universal internet. If we don't have access to internet, it's difficult to access to information. And again, Laura mentioned the importance to connect gender problems, gender issues, women, and access to information. And I think that and I agree with that, and I think that we need to move forward. And today is not just to talk about this thing in a binary way. I mean, we need to think about in transgender people, LGBT communities that are also experiencing problems on access to public information or to access any basic rights. Going to your question very briefly, yes, we did that. The executive in our country, as soon as the pandemic was a real global problem, enacted a regulation that suspended all the administrative procedures. So it was very difficult. I mean, it was impossible to request information unless we did what we did, which was to pass a resolution saying, yes, okay, we understand the problem, we understand the pandemic, but here we are dealing with a basic human rights, access to public information. If we put in practice this way to deal with the procedure, the process, in fact, in practice, we are going to suspend a human right. And this is not possible. This is not possible because the executive didn't enact a state of emergency. Access to public information should not be included, even if they enacted a state of emergency. So what we did was to say, hey, okay, it's fine with some procedures that people have before the administration, but not when you are requesting information. Not when you are coming to our agency when the ministries are not giving to you information. So we pass a resolution saying nothing happens, you can come here, the deadlines are maintained, and it was good. I mean, we received many claims. Yeah, not a lot, but we receive it. This is another problem. I mean, that people need to know more about the importance of access to information, but we continue working in a way that it would be impossible to work if we say, okay, yes, the procedure is suspended. So this is
lots of lessons to learn from these different approaches. Anthea, the ICA expressed their support for the UNESCO declaration, turning the threat of COVID-19 into an opportunity for greater support to documentary heritage. Which documentary heritage is, in which documentary heritage is really addressed as an important resource to offer a historical perspective on how governments and their citizens have faced pandemics. Can you tell us a little bit more about this initiative? Is it working well? And are many archives collecting documentary materials on this pandemic?
So I think you have to remember a little bit, the collection process is ongoing. for any archives, particularly public archives, because as we mentioned earlier, it starts from the point of creation. So many archives have already started identifying where the important materials and the important types of records are. And when I use the term records, I don't mean paper. I mean digital materials, I mean social media, I mean data, I mean artificial intelligence, I mean digital records more generally. I think in terms of more explicit active collection, that is happening more, I would say, in some regional archives and in some university archives. So there are archival programs that have identified themselves through our program Archives Are Accessible, that are actively going out into their respective communities and asking for testimonials, are asking for documentation, physical and digital, in order to document perspectives on the pandemic, the impact of the pandemic on the individual, which we don't necessarily hear in a lot of times in archives. Would I say it's successful? I don't know. I won't know for another 50 years just how successful that collection process is. But I think more importantly for this is the importance of, I hesitate to call it documentary heritage because it makes it seem like it's purely cultural. It's really about, I think, documentary accountability, duty to document, and ensuring that information, whether it rests in a government department or in a private corporation, or if it sits in an archives or in a library, wherever it happens to be, that information is accessible to citizens. And regardless of, I think that there are very excellent points made around questions of accessibility and around ensuring that we're very much digitally minded, but I think there are segments of the population that, as has rightly been pointed out, don't have access to steady internet. Depending on where in the world you are, you don't sometimes even have electricity, or you have infrequent electricity. And so in those contexts, it's sort of what does ensuring from an archival records perspective access to that information. And I think you need to understand where they're getting information, where are the users getting information, and in order to better provide and make that accessible. So that's about all I can say really about that.
I think that was very useful. I have a lot I could say about all the documentary heritage that is being put on certain platforms that could be of help if we knew how to curate it better. But Toby, what you have the last word before we move to the next video and then to the Q&A. So I see we have a lot of people watching us. Please put your questions in the chat. But Toby, let me ask you, after I really want to thank the panelists for their very rich contributions. For me, it's a delight to get to know all of you better, and I hope that we'll maintain contact. But really, Toby, what is the way forward? Some say that there's a need to put in place a new normal systems to ensure the regular processing of requests and appeal. Do you buy into that? What do you see as the way forward? Please unmute your mic.
Thanks. When you say the last word, it reminds me at the dinner after my wedding, my wife spoke last, and she said, "I mean to start as I'm going to start as I mean to go on, having the last word." So I'm okay with the last word. Yeah, I mean, I think everybody's talking about the new normal. Obviously, we are in a state of tremendous flux at the moment. Well, we have been since the pandemic struck. We really don't know how long that normal, as it were, or new normal is going to go on, or whatever. And I think that we at least need to restore basic human rights services. And I do just want to mention, I mean, I think on our tracker, we have a little space where we have highlighted the steps that Eduardo took, even though they didn't represent a legal change. So the tracker tracks legal changes, but that was the resistance of illegal change. And I think that's exactly a human rights approach. There was a lot of knee-jerk, administrative suspension of deadlines, and Eduardo's agency said, hang on, this is not just an administrative procedure, this is a human right, and we need certain standards around that, and this doesn't meet those standards. So I think it's, really congratulate him on that. I think we need to, we're restoring a lot of services in a lot of countries. Of course, we're going up and down a little bit. And I think that we need to, flowing from what I said before, we need to be treating access to information, or the right to information, as a core service, as a human right, as an essential service, and it needs to be in the front line of the restoration of services, even where that requires, as I said before, physical processing of requests. That still needs to be done unless it's really mandated not by the pandemic situation. I think that we have hopefully taken a few strengths from the pandemic. Of course, it was not a good period for any of us, but there are some positives from that. We have, in a lot of countries, pushed forward quite a lot in the digital space. And I mean, I fully agree with everything that Anthea said about the risks of moving to digital archives and digital record keeping. But in terms of responding to access to information requests, digital really is a very, very important leap forward. And so hopefully that digital push forward will enable that. I think several speakers have referred to the need, especially for proactive disclosure at this time, to reach everyone, women as well as men, linguistic minorities as well as mainstream vulnerable groups, the poor. There's a lot of groups that were at special risk during this time, and it was essential to get information to them. And governments have developed new, or some governments at least, have developed new systems for ensuring that proactive is more robust and especially more comprehensive than it had been before. And hopefully we will carry that into the future. And I hope also that we will, increasingly put in place emergency resistant systems overall for access to information. And I mean, a lot of that is digital. So, once we were working from home, we could do everything digitally. We just couldn't do things in paper form. So that's a big part of it, but also other communication systems and ways of working, like even formal legal requirements that are proof for the digital system, so that notice can be legal in nature, even though it's not sent by mail or whatever it is. So hopefully we will put in place those systems now, so that when future emergencies or this emergency rebounds, the so-called second wave, we'll be ready for it. I think that if we all think of this as both a human right and an essential service, we will find the resources and the interest level to do that.
Thank you, Toby. More food for thought, and we'll go back to exploring these issues further just after this video. We have a testimonial from a representative of the Ministry of Health of Uganda, describing how access to information has helped them withstand the burden of the pandemic. So could we have the video, please?
My name is Emmanuel Inibiona. I'm a senior public relations officer at the Ministry of Health, Uganda. My daily routine involves giving information to the general public about how the epidemic is evolving, issuing press releases on the guidance by scientists about the pandemic. In addition, I also respond to misinformation that keeps popping up about the COVID pandemic in Uganda. We largely employ a feedback-led communication mechanism that employs use of social media to counter misinformation and disinformation in real time.
Thank you. Excellent. And We have a lot of questions in the Q&A, and I would encourage panelists to have a look at what we have there. Some of them are not to any specific person. So I'm going to ask one of those very general questions, which aims, I can see, to be provocative. It is from Natasha Kramtovsky. I hope I pronounced your last name. And it says, to all experts, would you agree with me that excessive transparency of government's business potentially also could be harmful, pushing the officials to avoid difficult but necessary discussions and solutions, to minimize documenting of the decision-making process, and or create records with future disclosure in mind rather than public good or business needs? Would you agree that transparency, just like any medicine, should be used in moderation? And I throw that open to the entire panel, because if any of you agree with this, I will be deeply shocked. So who would like to come in on this one? I see Eduardo waving his hand. Toby, did you wave a hand? Yeah, okay, so after Eduardo, then Toby.
I don't like to talk about use transparency in moderation. I think that, Dorothy, you said if we agree, you are going to be shocked. I do not agree conceptually on that idea. However, I would like to put some sort of or some another perspective to that statement, which is we are part, with my colleagues that are here in the panel or in the public, with some of them, we are part of the International Conference of Information Commissioners, which is, you know, the meeting, a network of access to public information authorities around the world. We meet every year, we make statements, and so on and so forth. Well, regarding to pandemic, we very early this year, in April, we issued a statement about the importance of maintaining access to public information as a human right, to permit people to access to public records, transparency, and so on and so forth. But we also said that we need to have some sort of flexible approach when people are requesting information. What that means with flexible approach, and I will give you a concrete example in my own jurisdiction. Because we do not have yet that all the departments of the government have the document digitalized, it could happen that if someone requests a specific information and the information is in the office and the office is closed because of the pandemic, it is proportional, it is rush. I mean, it is not going to be a problem for us on the access to information exercise, to the right to access to information. If we say, okay, if you can demonstrate that you did whatever, I mean, all the activities that you have to do to get you as a public official to have that information and to give the information, and you really cannot do that because the office is closed, because it is in papers, because you have to go to an archive, and so on and so forth. Well, that is a flexible approach. We are in a special moment where we need to pay attention to those specific circumstances. That doesn't mean that we are going to give a blank check to any public official to say, no, you know what, I cannot give you this information because it is, well, no, wait a minute. All the information is in the office. You don't have anything that you can provide now. When you are planning, I mean, there are exceptions, maybe you can go. So we need to analyze case by case. But we adopted this idea to have a flexible approach, and flexibility means not to have diminishing transparency or diminishing access to information. Thank you.
Thank you. Toby, could you come in? And then Lucy, I see that there are two questions which are specifically for you. So after Toby, if you could have a look at the questions in the chat and get ready to respond. Toby, do you have a differing view from Eduardo on this issue?
Well, not essentially, but a couple of glosses on that. I mean, I think that in the modern era, with all of the mis and disinformation flowing around, it could be kind of seductive to suggest that too much information is poisonous. But I think it's very important to keep in mind that what we're talking about here is the right to access information held by public authorities. We're not talking about, the people gossiping or on Facebook or whatever it is. We're talking about information that we hope has some degree of reliability and accuracy inherent in it. That's not to say that public authorities can't make mistakes, but we're not talking about sort of the free flow of information in general. So I think that it's too much of it is not poisonous. It might be a little bit confusing. But looking at the question, I think we can probe a little bit more deeply into it. First of all, most right to information laws do recognize that government needs an internal space to talk. So they have an exception, for example, to preserve the free and frank disclosure of advice within government, so that government officials can talk freely without, always thinking that everybody's going to be looking at what I'm saying and be intimidated by saying things for that. So that's one part of my answer. The question also suggests that officials may engage in avoidance schemes on producing or documenting decisions in the first place. And I think we have seen that in a lot of countries. And one of our responses to that has been to recommend that laws include a duty to document, that decision-making processes should be legally required to be documented, so that if you don't document, then you're not just avoiding the law, you're evading the law, to use tax evasion terms. And I think we need to have strong enforcement systems so that the rules in the law are respected. And in that way, I think we can find a balance between allowing governments to operate successfully and effectively by talking freely inside, and yet giving us access to all of the information which is covered by the law. So I think a fair balance can be found in this case.
Dorothy, can I just jump in quickly?
Yeah.
So I'm not going to, I think what both Eduardo and Toby have said are completely valid. I don't think you can have transparency is incredibly important. I think when we look at this from countries that have a lot more digital technologies involved and that have used multiple platforms, I think the greatest risk right now to transparency is actually just the amount of information that needs to be parsed through in order to answer access requests moving forward. And I think right now that is something that when I worked in UK government, we really hadn't gotten to grips with. I think the technologies that we can use, like artificial intelligence, are badly understood by the communities involved in some of this. And I think it's a risk for us in terms of access to information and transparency. I have seen instances already where because information has been stored external to a government platform, which is fine, it's that they've tried to use that as a reason not to render the information in an access request. So I think we need to come to grips with the new technologies and the impact of those new technologies on transparency.
That's an excellent point. Thank you so much, Anthea. Let's move to these two questions that have come from Lucy. And there is a question in French. I will warn us, there's a question in French that touches on similar issues to what we just discussed. Lucy, it says, why does the CAJ exclude records managers and archivists in their quest to implement the ATI law? And then another one, the deadline for digitizing records as per the Kenyan law was 2016. Why isn't the CAJ asking questions as to why this has not been done? Why isn't it being done? I suspect it's being done. It may not be completed. So if you could answer those two questions, and then we'll move to the question in French after your response.
Thank you. And I want to state that archivists have a duty and a role to play under our ATI Act. It is very express. And as a commission, what we did with the Kenya Archives and Record Management Authority was to set up a committee whereby we sit together, talk together, and agree on one, the destruction of records. There are certain ministries which request that certain records which have been in force for the last maybe 7 years, 10 years, and were not in need should be destroyed. They are not supposed to destroy without the concurrence of our office. And this committee is specifically requested to look at it and agree. That is one. Number two, we are still in the process of coming up with ATI regulations. And one of the members of the task force dealing with the regulations development is a member from the same authority. And I must confess that they did give us very useful insights, a lot of information, which as a commission, we did not know. They actually helped us develop almost a whole chapter on records management in our ATI regulations. So we do work together. Further, we do have engagements whereby we have been training public officers on archiving together with the same authority. So what I'm trying to say is that perhaps we should do more. Perhaps we should reach out and talk about our activities, because from the question, some people do not know. That is one, and I hope I have answered it. On the issue of digitization of records, it is true our act states that by 2019, government institutions should have digitized all their records. And like I stated earlier on, our regulations are still not ready, not yet in force, and there's a whole lot of how are you going to digitize government records without regulations or without a regulations touching on that section of the law. So we have engaged, or we are in engagement with the Ministry of ICT, and they did provide a lot of information in our regulations on how we should digitize records. Further than that, ICT Ministry has come up with certain policies on how to digitize government records in a structured way. And only yesterday, our CAS did promise us that that policy will be put in place and digitization will go on. That does not mean that nothing is happening. We have many committees working on digitization of records in many ministries. We also have a standing committee in our office working on how to digitize record. Even as I sit here, our ICT manager is here listening, and I do know that our chairperson did request that one of our take home this year is digitization of CAJ records to be an example to the other ministries.
Thank you. Thank you so much. I'm just going to read these questions out because we are running slightly behind schedule. Thank you, Lucy, for shedding light on what's happening in Kenya. But this question says, which strategies are being implemented to convince, it's not, English is not a first language here, getting the complete information on COVID cases is not threatening to the security of people, but could it be useful to track cases and give peace of mind to the citizens of a country who just for now feel like they are fighting a war? And then we have one in French, dans un but de transparence.
In order to ensure transparency and accessibility of information, and in particular, and in periods of crisis, and is all the information that we need to provide to the public, notwithstanding the fact that this may be sensitive information, is being provided. Donc,
questions are overlapping. And I would like a quick reaction before we pass to the next video. Any hands? Anthea, please, you've got the floor.
So I'll answer the French one if Toby wants to take the English one. Alors, pour répondre à votre question, je crois
to answer your question, I think the answer was given by Mr. Mendel and Mr. Bertone. Yes, there's clearly information that is sensitive, that is in the documents during the crisis. But what I would say on this is that governments are entitled to retain information. And now, if it's public information, can we provide the information proactively? And I think that's the point that Madame Noumet was trying to raise when she answered the question. So it's the balance between access to information on the one hand and protection of privacy on the other hand, data access. I think one should not be a threat to the other. You need to strike a balance.
Can I just add
Thank you for that, reminding us of balance. Toby, if you want to come in.
Yeah, so I'm going to answer the two questions together because I think they're basically overlapping as I understand them, and my comments reflect what Anthea says. I mean, we have within the human rights world and the access to information world as well, systems for balancing competitions between interests, and particularly interest between rights. And I think that during the COVID crisis, the countervailing interest to transparency that came up most often was privacy. So we have a medical emergency, we have specific people getting sick in specific places and so on and so forth, and how much of that needed to be disclosed to the public so that they could protect themselves and have their anxiety and concerns mitigated at least. And I think there were, and our report that we prepared for UNESCO does give some examples of this. There were certainly a number of cases where public authorities overreached. They provided information that really wasn't necessary for people to know and to protect themselves and to understand what was going on, and that did invade privacy. Even in my own province of Canada, it's a small province of 1 million people. The first 3 cases, we had 3 cases on the first day, and they gave the age, the gender, and the location of those 3 people and where they had traveled from. So everybody had come from outside because, I mean, the location I think was perfectly legitimate, so people could know that in their community there was a case, but the gender, the age, where the person came from, nobody was going to be going anywhere, so it wasn't important that the person had come from Australia. So, and we have a number of cases of that. But I think that, where there's a conflict between rights, international law says where the overriding public interest is, that right shall prevail. And often that does mean that access to information trumps privacy, but only where that really is in the public interest, and those cases don't disclose that. So I think there are systems for balancing that, and there were mistakes made, but it was inevitable in the rush of the early days of the crisis.
Thank you. Just telling us we need to prepare better for the next round. Now, if I could invite our video controller to show us the testimonial of journalists from Palestine talking about the importance of ATI in times of crisis.
Hello, my name is Jala Abu Arab, and I am a journalist from Palestine. My work as a journalist requires me gathering and offering information for citizens to make them feel more empowered and more involved in the decisions that affect their daily life. In my organization, we work very hard to fight fake news. And in order to fight fake news, I have to get the information, the right information, from its source. And when I do not get that, I am stuck with an article or with breaking news or with a video that I cannot finish, or I have to go other ways to find this information. And I think if we have the right to access information, both officials and citizens can have its benefits.
Thank you for that video. Difficult situation and important recommendation, I think. We've really come to the end of this session, and it's been very enjoyable. And it's always just as we really start getting into the issues that we are forced to end our webinar. One of the things that I will retain from our conversation, and I think all of us strongly believe that the right to information is a human right, and we should never forget that. The other thing is that approaches can't be a one-size-fits-all. I think you told us that, Anthea, in a very pragmatic way. We have to look at what is the base situation and what makes the most sense in that situation. And we were also reminded of the importance of reaching out to specific groups such as women. And I like that campaign, Inform Women, Transform Lives. We shouldn't forget that. And I'm going to mention this because in the chat, I felt the frustration of a few archivists who feel that they have been left to the side. They haven't been included enough in all of this. But I think that the most important thing that I can say in order to stay within time, because I could talk for half an hour on this, is that we must have a balanced approach. And those balances have been in some cases incorporated into the legal frameworks, but they do require us to think. And I think that what's very clear to me is we need to have in place an emergency response strategy for information in times of crisis, so that we have something already there telling us how to go about it. And of course, depending on the crisis, we will tweak it, we will adjust it, but there must be some plan in place because this is so critical to saving lives. I want to thank all of you for your wonderful contributions. It was great to be in Canada, in Argentina, in Kenya. Actually, Anthea, I don't know where you are. Is that who? Where are you?
Paris.
And in France. And, thank you for your wonderful contributions, and we'll stay in touch. Let me now invite our very powerful video presenter to end this session with a brief presentation of the findings of the UNESCO World Trends Report. Thank you all. Let's watch the video. Rassem, do we have the video? We seem to have a short, good.
L'enregistrement a été interrompu.